The Information Communications and Technology Council plays a significant role in studying and analyzing the shortage of skilled workers to share with the health industry. The sector requires employees with a complex set of skills that are both ICT intensive and deep in the domain knowledge of health.
eHealth competency profiles, or all competency profiles, are really built around making sure that we understand what are the knowledge, skills, and abilities of eHealth workers in Canada. And we use those so that we can develop the skills and professionals for today and, more importantly, for tomorrow to meet the needs of the workforce. As a matter of fact, the tagline that we use at ICTC is, we're developing tomorrow's workforce today. And the competency framework, the competency profiles, are really the key component to do that.
ICTC has developed eHealth competency profiles to support and raise awareness in key groups, such as health institution employers, educators, and employees looking for guidance on professional training and opportunities.
Somebody some time ago said that practicing of medicine is processing information. So doctors are, we know what kind of competencies they need to have. Nurses, they go through the training, but people who produce this information, it looks right now, it can be anybody.
The inadequate supply for eHealth human resources presents a major challenge in meeting current and future demands for eHealth adoption across the system.
Competency profiles can help the shortage in the workforce in a number of ways. I think the first way that they can help is by identifying those skills that are perhaps common across multiple segments. People outside of a particular work area can then find areas that are of interest to them and move and migrate to that area where those skills are required. It also helps those individuals that perhaps are looking for onwards advancement in a particular career field, and then identify those skills and requirements that are needed in order to work in that particular area. I think they help then the community as well, the education community and those of us in private sector identify courses and learning opportunities to help increase the number of people in a particular segment.
Since 2001, Canada Health Infoway has allocated more than $1.57 billion to investments in electronic health information systems.
Competency profiles in healthcare are important today and will be even more important in the future as healthcare evolves and changes in several different ways. In terms of people's professional development, they need targets that show certain skill profiles that they would need to gain, some soft skills, some technical skills, in order to achieve another level. And these competencies show milestones or place marks that they can shoot towards in terms of planning their own professional development. So that's quite a useful tool as people, like I did years ago, come out of school and wonder how they get from point A to point B.
The implementation of large-scale investments in electronic health information systems technologies has two consequences for human resources. The first is to increase the number of health informatics and health information management professionals required. The second is to increase the proportion of these professionals whose skills will need to be broadened as a result of the implementation of electronic health information systems technologies. ICTC's eHealth develops competency profiles to enable employers to lead recruitment processes and succession planning in their organizations, to assist in determining and developing needs through skills gap analysis, as well as retain top talent through performance management, review comprehensive job profiles from a database, and match relevant competencies and behaviors with specific positions, share and develop effective interview guides to ensure prospective employees possess the required skills and experience, validate technical knowledge, industry experience, and business and interpersonal skills of ICT professionals. For educators, ICTC's competency profiles will allow to establish and review courses against learning outcomes that reflect local or regional industry requirements, design and deliver training for professional development, Provide employees with a description of the knowledge, skills, and abilities needed for career pathing. Identify skills gap and target professional training for career development. Proper training and skills development must start early in the educational system at all levels.
When we started building the competency profiles for the eHealth area, we had some hopes and some dreams. And it was really that we would be able to define the competencies that professionals could use. And our hopes and dreams are that the eHealth community embraces these and develops a workforce so Canada will have the talent it needs going forward.